Sildenafil citrate is a sexual medicine. It is made for educational purposes. Educational video only. Do not take this medicine without the advice of a registered doctor. Thank you.
Sildenafil Citrate. Also available as 50 milligrams, 100 milligrams indications. Treatment of men with erectile dysfunction, which is the inability to achieve or maintain a penile erection sufficient for satisfactory sexual performance. In order for AGRA to be effective, sexual stimulation is required. AGRA is also indicated in pulmonary arterial hypertension, when sexual stimulation causes the local release of nitric oxide. Inhibition of PED5 by AGRA produces increased levels of cGMP in the corpus cavernosum. This results in smooth muscle relaxation and inflow of blood into the penile tissues, thereby producing an erection. AGRA has no effect in the absence of sexual stimulation. Description: is a selective, reversible inhibitor of cyclic guanosine monophosphate, specific phosphodiesterase, type 5. Pharmacology: it is eliminated predominantly by hepatic metabolism and is converted to an active metabolite with properties similar to the parent, sildenafil. Maximum observed plasma concentrations are reached within 30 to 120 minutes, of oral dosing in the fasted state. When sildenafil is taken with a high-fat meal, the rate of absorption is reduced. Both sildenafil and the metabolite have terminal half-lives of about 4 hours, and 107% higher plasma AUC values of sildenafil compared to those seen in healthy younger volunteers. After either oral or intravenous administration, sildenafil is excreted as metabolites predominantly in the feces, and to a lesser extent in the urine. Pharmacology. Mechanism of action. The physiologic mechanism of erection of the penis involves release of nitric oxide, however. Sildenafil may be taken anywhere from 4 hours to 0.5 hour before sexual activity, based on effectiveness and toleration. The dose may be increased to a maximum recommended dose of 100 milligrams or decreased to 25 milligrams. The maximum recommended dosing frequency is once per day. In the corpus cavernosum during sexual stimulation, NO then activates the enzyme guanylate cyclase, which results in increased levels of cyclic guanosine monophosphate, producing smooth muscle relaxation in the corpus cavernosum and allowing inflow of blood. Concomitant use of potent cytochrome P4503A4 inhibitors. Since higher plasma levels may increase both the efficacy and incidence of adverse events, a starting dose of 25 milligrams should be considered in these patients. Sildenafil was shown to potentiate the hypotensive effects of nitrates and its administration in patients who use nitric oxide donors, or nitrates in any form is therefore contraindicated. When sildenafil is co-administered with an alpha blocker, patients should be stable on alpha blocker therapy prior to initiating sildenafil treatment, and sildenafil should be initiated at the lowest dose. Sildenafil has no direct relaxant effect on isolated human corpus cavernosum, but enhances the effect of nitric oxide by inhibiting phosphodiesterase type 5, which is responsible for degradation of cGMP in the corpus cavernosum. When sexual stimulation causes local release of NO, inhibition of PDE5 by sildenafil causes increased levels of cGMP in the corpus cavernosum, resulting in smooth muscle relaxation and inflow of blood to the corpus cavernosum. Sildenafil at recommended doses has no effect in the absence of sexual stimulation, pharmacokinetics, and metabolism. Sildenafil is rapidly absorbed after oral administration, the mean absolute bioavailability of 41%. Absorption and distribution: sildenafil is rapidly absorbed. Metabolism and excretion: sildenafil is cleared by hepatic microsomal enzymes. Pharmacokinetics in special populations, geriatrics. Healthy elderly volunteers had a reduced clearance of sildenafil, resulting in approximately 84% dosage and administration. Erectile dysfunction: for most patients, the recommended dose is 50 milligrams taken, as needed, approximately 1 hour before sexual activity. Most but not all of these patients had pre-existing cardiovascular risk factors. Many of these events were reported to occur during or shortly after sexual activity, and a few were reported to occur shortly after the use of AGRA without sexual activity. Others were reported to have occurred hours to days after the use of AGRA and sexual activity. It is not possible to determine whether these events are related directly to AGRA, to sexual activity, to the patient's underlying 23 cardiovascular disease, to a combination of these factors or to other factors. The following factors are associated with increased plasma levels of sildenafil: age greater than 65, hepatic impairment, severe renal impairment, pulmonary arterial hypertension. The recommended dose of sildenafil citrate is 20 milligrams, 3 times a day, and should be taken approximately 4 to 6 hours apart, with or without food. Side effects: body as a whole, face, edema, photosensitivity, reaction, shock, asthenia, pain, chills, accidental fall, abdominal pain, allergic reaction, chest pain, accidental injury. An animal study shows that sildenafil has no evidence of teratogenicity or embryotoxicity. Cardiovascular: angina, pectoris, AV block, migraine, syncope, tachycardia, palpitation, hypotension, postural hypotension, myocardial ischemia, cerebral thrombosis, cardiac arrest, heart failure, abnormal electrocardiogram, cardiomyopathy, digestive, vomiting, glossitis, colitis, dysphagia, gastritis, gastroenteritis, esophagitis, stomatitis, dry mouth, liver function tests, abnormal rectal hemorrhage, gingivitis, hemic and lymphatic, anemia and leukopenia, metabolic and nutritional, thirst, edema, gout, unstable diabetes, hyperglycemia, peripheral edema, hyperglycemia, hyperglycemic reaction, hypernatremia, skeletal, arthritis, arthrosis, myalgia, tendon rupture, tenosynovitis, bone pain, myasthenia, synovitis, nervous, ataxia, hypertonia, neuralgia, neuropathy, paresthesia, tremor, vertigo, depression, insomnia, somnolence, abnormal dreams, reflexes decreased, hyperesthesia, respiratory, asthma, dyspnea, laryngitis, pharyngitis, sinusitis, bronchitis, sputum increased, cough increased, skin and appendages, urticaria, herpes simplex, pruritus, sweating skin ulcer, exfoliative dermatitis, special senses, sudden decrease or loss of hearing, mydriasis, conjunctivitis, photophobia, tinnitus, eye pain, eye hemorrhage, cataract, dry eyes, urogenital, cystitis, nocturia, urinary frequency, breast enlargement, urinary incontinence, abnormal ejaculation, genital edema, and anorgasmia. Cardiovascular and cerebrovascular. Serious cardiovascular. Cerebrovascular and vascular events, including myocardial infarction, sudden cardiac death, ventricular arrhythmia, cerebrovascular hemorrhage, transient ischemic attack, hypertension, subarachnoid and intracerebral hemorrhages. And pulmonary hemorrhage have been reported post-marketing in temporal association with the use of Agra. Nervous, seizure recurrence, anxiety, and transient global amnesia. Urogenital, prolonged erection, priapism, and hematuria, special senses, diplopia, temporary vision loss, decreased vision, ocular redness or bloodshot appearance, ocular burning, ocular swelling pressure, increased intraocular pressure, retinal vascular disease, or bleeding, vitreous detachment, traction, paramacular edema, and epistaxis. Pregnancy and lactation. Pregnancy Category B, there are no adequate and well-controlled studies of sildenafil in pregnant women. Sildenafil is not indicated for use by women. Therapeutic class. Drugs for erectile dysfunction, storage conditions. Keep in a dry place, away from light and heat. Keep out of the reach of children.
Sildenafil Citrate একটি যৌন উত্তেজনামূলক ঔষধ। এটি শিক্ষামূলক উদ্দেশ্যে তৈরি করা হয়েছে, শুধুমাত্র শিক্ষার জন্যই প্রযোজ্য। নিবন্ধনকৃত ডাক্তারের পরামর্শ ছাড়া এই ওষুধটি সেবন করবেন না। ধন্যবাদ।